Well, one of the biggest challenges of the pandemic has been the availability of reliable testing. Joining us to talk about the impact of a breakthrough test is Dr. Lance Baldo, along with advocate Diana Barrett. Thank you so much for being with us.
Good to be here.
Hi, how are you?
I'm doing well, and I'm happy to have you here. I want to start with you, Dr. Baldo. Tell us about this new test.
Yeah, Elsa, just this past Friday, the FDA issued what's called an emergency use authorization for TDetect COVID. And this is the first clinical test for patients. And what it does is it uses T cells to be able to diagnose recent or past COVID 19. To be able to get more information or to order the test, you can go to t-detect.com, and everything can be done online with the exception of the blood draw. So we do need a sample of your blood, but to do that, you can either go to one of about 2,000 LabCorp service centers around the country, or if you prefer, you could select that you'd like to have a blood draw person come to you, and we'll send someone to the security and comfort of your own house. And then about 7 to 10 days later, you'll get a report via secure portal to be able to tell you whether or not in the past you had COVID-19.
And why is it important to know if we have had COVID-19, past tense?
So I have to tell you, as a patient, I actually got COVID 1 year ago today. And I was extraordinarily lucky. I had to fight tooth and nail to get a test, but I was extremely fortunate to get one most people weren't. And what we're finding out is that so many people who had COVID are not recovering. And they need, if you had COVID, for example, the guidance is that you should have cardiac clearance before returning to exercise. But if you're not sure if you had COVID, that's a hard rule to follow. So as the landscape gets more and more complex in the coming year, and we have all of these personal choices to make based on our own unique immunological profile, this is like taking a snapshot. This is like getting a fingerprint of your immune system to help you make those choices.
And talk about the importance of supporting COVID-19 survivors.
Well, I mean, what we are seeing is what we originally thought was a respiratory disease and then learned was a vascular and inflammatory disease. And I believe will one day be seen retrospectively as also a neurological disease. It can affect and damage literally every single organ in your body that relies on blood flow, which is PS, all of them. And so this information, I mean, this test is, in a way, if you think about it, is like the human genome project of the immune system. And so getting that information, being able to be the steward of your own data as a patient is just going to be increasingly important as we move on from COVID-19 and, hopefully put this in the past, but the legacy will be with us for some time.
What else does this new test do to help people who suspect that they've had COVID-19?
Well, also the first test to use T cells here on the TDetect platform is to be able to detect past COVID-19. But we could use these same T cells, use the T cells in your body to diagnose a host of different diseases that fall into a bunch of different categories, including other infectious diseases, autoimmune diseases, or even being able to pick up cancer early. And so while this TDetect COVID test is the first to use T cells to diagnose an infection, it's only the first in what's hoped to be many over the next coming months and years.
And where can we go for more information?
Simply go to t-detect.com, where you can get a lot more information or place an order for the test.
All right. Thank you both for being with us today. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.